Hello, my name is Dr. Michiel Opperman. I'm a qualified chiropractor and I specialize in animal chiropractic. My main focus is normally equine chiropractic. I studied human chiropractic at the University of Johannesburg in South Africa. I did my specialization in animal chiropractic in America in Texas at ACES University, which was about a 2.5-year post-grad course. And I also have a human practice which is situated in Pretoria in South Africa, and then I travel throughout the country and all over the world treating horses. Why should my horse see an animal chiropractor? If we struggle with persisting lameness, uneven muscle development, struggling on a certain rein, struggling to turn and bend to a certain direction, all these can be caused by muscle imbalances or restrictions in the vertebra and in certain joints. Also, that can cause sometimes is muscle spasm due to the restrictions, and with chiropractic adjustment as well as muscle soft tissue treatment, we can resolve a lot of these problems without having to inject or give medicine to the horse, which is far safer and far more healthier to the animal. Also, a big reason for the horse sometimes not being able to do certain exercises for going into, for instance, into a gallop or a slow trot is normally because of discomfort, and that can also be caused by a restriction, also by certain muscle spasms in the body that won't allow the horse to move freely through his body, which makes the certain movements painful or more restrictive. Also, a change in the animal's attitude or personality a lot of times is contributed because the horse is in pain and therefore cannot move like it's supposed to, and that will then lead to uneven development, also uneven development of muscles, as well as gait, as well as posture of the animal or the conformation of the horse. Common causes to the strains as well as restrictions forming, a lot to do is the workload that the horse is under. For instance, a show jumper, they will have more shoulder issues as well as issues in their lower cervical region because they tend to land or favor one specific leg, and the impact from the rider together the impact from the horse all collides normally around C7, and we have a lot of shoulders and sort of where the neck goes into the shoulder, we have a lot of problems happening there. And if your horse tends to favor one leg, with landing on one leg, we'll have that specific shoulder being more overused and therefore having some issues normally. Also lower down the leg onto the knee itself, there's a lot of things happening there as well, because when the horse lands, the hoof works like a shock absorber, and if the hoof is out or the tendon is out, that shock absorber doesn't work correctly, and we can sometimes tend to pull tendons. The other thing as well, for instance in dressage, where the horse has to collect and sit backwards onto its hind quarters, if there's an issue in the lumbar spine or in the SI region, he will struggle to sit back because it's painful. So he will be more on the forehand, and therefore we'll get not a good score during your competition. The other thing is as well is, for instance, in racehorses, because they go onto one corner all the time since they were babies, it's similar to when a child has to wear a backpack and he just wears one strap. They grow skew and they're going on that one rein all the time, and the only place they can compensate is in the SI joint, and we tend to have a lot of SI joint restrictions and muscle spasm around the SI joint because of going on that one rein all the time. Then as well as in endurance horses, because we don't change the rein often enough, we keep on one rein, the one side is overworked, and therefore we'll have a unilateral issue from left front to left hind because we're not changing reins from left to right as often as we can. Then, for instance, in barrel racing, because we far more on the forehand, because we have to pull away, we'll have a lot of issues in the bottom of the neck on both sides as well as the shoulders, because they're pulling from the front more than pushing from behind. Also, a big thing that we find is ill-fitting saddles. The weather over the horse is the most sensitive part almost. So if we don't have a correct fitting saddle, there will be increased pressure over the wither. Our horse won't be able to go into a proper form. We'll normally have a horse that hollows out its back, also that lifts its head up high. What then happens is we change saddles, but the problem wasn't resolved. The pain still stays there. So we open a big can of worms because we're just going over in circles and circles, because we have to change the saddle, but we also need to fix the problem that the horse has. It's like if I have a mattress that hurts my back, if I change the mattress, it won't fix my back. I need to get my back fixed by a chiropractor, then the whole problem will resolve. What you typically can expect from a treatment session, we'll first do a full physical. We'll trot the horse out, see how the horse is moving, walk the horse, see if there's a struggle going from one gait to another gait, look at the stride lengths of each leg. Also, you can hear when the stride is not the same, you'll have an offbeat because of the shoe. Then after the assessment, we'll explain exactly what I found and what the solution should be. Normally we'll start with soft tissue, then we'll sort out all the muscle spasms that is associated with the diagnosis as well. And then after that, once that's been resolved, we will then adjust the joints that cause the problem that we are dealing with. I treat a lot of endurance horses as well as endurance riders. I have a big love for Arabian horses as well as the sport itself, because it is so demanding on both the horses and the riders. It is very important to be very, very specific in the treatment and make sure that the horse is 100% so that we can pass the vetting after each leg.